Good afternoon. I'd like to talk to you about the circulation of the heart in a newborn infant. And in fact, it's different than the circulation in an adult. So we talk about two different things here in circulation. We talk about the fetal circulation and the adult circulation. And then I'm going to speak to you about what we're looking for when we do the heart exam of a newborn infant. So first let's talk about the adult circulation. So our blood is all over our body, and basically it comes back to the heart. It goes into the heart. The heart then pumps it out to our lungs so that we can get oxygen. It then goes back into our heart, and then the blood is pumped out of our heart to feed the entire body. It gets, in the end, pumped out into our aorta, and it feeds the blood to our head, to our brain, and to arms, legs, and body, and all of our organs. However, the fetal circulation is not the same as the adult circulation. The blood does circulate through the baby, and it does come back to the heart, but remember, the baby is not breathing inside the mother, and it's the placenta that is delivering oxygen from the mother to the baby's blood, and that's how the baby gets oxygen, not by breathing, because there's obviously no air inside the mother. The infant is swimming around in amniotic fluid. So what goes on with the baby, with the fetal circulation, is the blood comes back to the heart, and then the blood bypasses. It never gets pumped out into the lungs. It bypasses, and it just goes through the heart to the big pump on the left side of the heart, and then goes out for distribution to the rest of the body. Well, that works really well while the baby is inside the mother, and while the baby has an umbilical cord and there's a placenta in between the infant and the mother. Well, the infant is born, the cord is clamped and then cut, and now the baby's on its own. And so quickly after birth, the pressures within the heart start to change, and this path of the blood starts to change, because the only way for the infant to get oxygen is to now start pumping that blood from the right side of the heart, where it comes back to the heart. It's got to now, just like in the adult circulation, go out to the lungs, come back to the heart, and then out to the rest of the baby. Well, you can imagine this is a complicated process, and it does not occur all at once at the snap of a finger. And in fact, it takes days for it slowly but surely to change from the fetal circulation to the adult circulation. During this time period of the switchover from fetal to adult circulation, it is very frequent that we hear heart murmurs. And a heart murmur is simply an extra sound of the heart. And I'll give you an example. You see on TV or in movies, you can always see that EKG that goes up and down, and you've heard it as well. And you know your heart goes boom, 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 and that's a regular rhythm of an adult heart. The extra sound of a murmur sometimes is as follows: bump, 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 and it's that extra that's in between the two bumps that is the extra sound of a murmur. Well, in an adult that has a murmur, we immediately have some concerns and are completely investigating that. But in the newborn infant, going from the fetal to the adult circulation, we frequently get that extra sound of a murmur. Now, we're careful with that, because although almost all the time that extra murmur sound in the first few days is normal, sometimes it's not normal. So I would say that frequently we get a cardiology consult to take a look at the heart, to do an EKG. Sometimes they will do other exams of the heart, do an echocardiogram of the heart, just to make sure, in fact, that that murmur, that extra sound, is normal and that they expect it to go away. So please don't get concerned if we ask a cardiologist to come in to listen to a murmur and work up a murmur with an echo or an EKG. We're doing that just to confirm that it is a normal sound of the changeover from the fetal circulation to the adult circulation. And even if the workup is normal, either in the nursery when we hear a murmur, or shortly thereafter when you come in for your first checkups, the cardiologist will continue to follow that heart, that infant, for a little bit of time just to confirm that everything is okay. We're very careful with newborns, we're very careful with all of our patients, but we certainly don't want to miss any kind of a problem that we could do something about. So even if you have a normal exam in the nursery during the first 2 days of life, then you get discharged, then you come here to us either the day after discharge or 2 days after discharge. Don't be surprised if we at that time hear a murmur and ask for a cardiology consult. Again, don't be worried. It's very frequent, and almost all the time it is simply a sign of the switchover of the baby's circulatory system from the fetal circulation to the adult circulation.